literacy is a growing concern in Canada, with almost 6% of people lacking the basic health and literacy skills to navigate health information. But a new partnership between Women's College Hospital and the Toronto Public Library is aiming at providing accessible and evidence-based information to the community.
So joining us live now for more on this is Dr. Rulan Parekh, Vice President of Academics at Women's College Hospital. Dr. Parekh, thanks so much for joining us this morning.
Thank you.
First of all, congratulations on this. I know it launched in January of this year. It sounds like it's needed. Talk about why the partnership with the Toronto Public Library is a great option for bringing the more education to people for health and science education.
I think it's evident, since the pandemic, that lack of information is really important, that we need to get good information, the right information, out to the community. And, I think TikTok's gone wild with all these local experts and medical experts, which aren't really experts. And so what we need to do is really get the real information out to the community. And the best way to do it is have direct conversations and have direct presentations from the scientists about how science has impacted healthcare in their various areas, and then give time for the community to actually ask questions. So what we do is we have about a 30, 40-minute sort of talk about the latest science and what it means to them in whether they had diabetes or depression after pregnancy. And then they hear about the latest science, and then what they're able to do then is ask questions to the expert. And sort of that conversation really helps us quite a lot, I think, in developing a rapport with the community and also making sure that they get informed about their health care.
I realize, Doctor, that a lot of this is taking place at Toronto Public Library, but are you trying to meet the people who don't understand or don't want to hear it on social media? Do you take any of this and put it out there? Because like you said, TikTok, any social media page, that is kind of going wild with misinformation or just completely false information here. How do you tackle that with the people who don't show up to the library? Because I think that might be the greater issue.
Yeah, I think that even though the library has something like 45 million times that they get access, it doesn't necessarily mean everyone's going to look at it, right? And so we're trying to make sure that the videos are available. We're trying to what we're going to do over the next few months is start developing infographics so that you get a single one-page summary. And we'll continue to evolve this partnership over time to see how we can continue to improve knowledge dissemination. Like, how do you get the right information about your healthcare, and how do you really make sure that it's evidence-based? And so what our hope is to be able to show people not only what the information is, but then also provide the evidence so that they can read it themselves.
The thing I find about a lot of medical information is, as a layman, it can be a little overwhelming, right? Terms, words that you can't even sort of read or pronounce in some cases. How do you help people overcome that? Because there's that intimidation factor there.
Yeah, I think we need to start doing bite-sized pieces, and we should learn from TikTok, right? Not necessarily making TikTok videos. I'm not ready to become a TikTok influencer, but I think it's really, how do you give package-sized information that people can get, and they can get repeatedly, and they can access it when they need to access it. And so it's almost like you need to create almost like a library with the Toronto Public Library of little bits of information that you can get, books that you could read, information that you can continue to gather. And so between us and the library, the hope is to be able to have this repository of information that people can access.
Yeah, I love that you're shoring up the information people need to advocate for themselves when it comes to healthcare. It shows that, 60% of Canadians 16 and older lack the basic health literacy skills, but that rises to 80% when you're dealing with seniors. I just want to point out an example, dementia, Alzheimer's. This is something where people, even with the knowledge, are saying that they're not getting as much help they need on the other side from healthcare providers who might not be equipped to diagnose and help with issues like that. So are you seeing a gap, like people have the knowledge, but are they able to get the appropriate healthcare on the other end?
I think that the healthcare providers are able to give information during a clinic visit that's relatively short and, again, relatively bite-sized, but you may not really understand all the medications that you're being prescribed. So the idea is that how can we make sure that you got access to additional information regarding the medications, or how should your care provider help you, especially when you think about dementia? Like, what are the different things that we could intervene on? What's the home help that you could possibly access? These are really important questions in our healthcare system. We're not going to be able to answer all of them with the work that we do, but the hope is that we'll be able to get people access to information that they want to get and be able to direct them. The Toronto Public Library also partners with Toronto Public Health. And so I think with these kind of partnerships, as we continue to build out these networks, it's just to make sure people can get access to information and they aren't sitting there in the dark, not able to navigate through. If they don't have a family physician, how else could they get information? And I think that the province, along with the hospitals, along with the library. I think the idea is that we just need knowledge to get out there, and people need to be able to get access to it as fast as possible.
Disseminating facts. Yeah, exactly.
Yeah, that's right.
So where can people access this webinar that I know is online
So they
right
can
now?
do two places. They can go to the Women's College Hospital website and just look up Toronto Public Library Bridging Minds, and then they'll be able to get our link, and they'll be able to see prior videos, and they'll be able to get the link to the Toronto Public Library where they can then register also.
And it's all free, which is great.
And it's all free. Yeah.
Great idea indeed. Doctor, thanks so much for joining us this morning.
Thank you so much for
Appreciate
having
meeting
me.
you. Thank you so much.
Thank you, Doctor.
Great
Appreciate
initiative.
it.